Good morning. My name is Kathleen Koth. It's my pleasure to present this lecture to you today. I've been asked to say a little bit about why I love working with children with intellectual developmental disorder and autism spectrum disorders. I'm the proud daughter of a mom who's a special education teacher, so I spent lots of time in her classroom growing up, wondering how she had so much patience for kids with special needs. And then after college, my first job was at the Kennedy Krieger Institute on the neurobehavioral unit, where I learned that I really love to work with kids who are nonverbal. And using different skills and different listening skills to communicate with them and understand what was going on with them. That actually led me back to medical school and a career of working in many different settings. I've worked in inpatient, outpatient schools, residential, and settings with kids with these two disorders. And I really continue to love that journey with the families as I'm an outpatient physician right now, and continuing to advocate for children who are nonverbal and need someone to help advocate for them. So today we're going to talk about the school intervention process and the professional teams that we all work in to help children on the spectrum or with any of the intellectual disabilities navigate the school process and help you understand a little bit more about the entire team of people it takes to advocate for these children in the school setting and many other settings. I have no disclosures. So today's objectives are to understand the requirements for an individualized education plan and a 504 plan, and to help identify the team members in their areas of expertise in ASD and IDD. So we'll start with individualized education plans, so IEPs and 504s. So both IEPs and 504s are actually part of federal law. And so we will start today to understand how they came about and where they are today in the history of federal law. So there was actually nothing protecting the education for children with special needs until 1975, when the Education for All Handicapped Children Act of 1975 was passed. It assured that all children with disabilities had available to them a free, appropriate public education, which emphasized special education and related services designed to meet their unique needs. It assured that the rights of children with disabilities and their parents be protected. It assisted the states and localities to provide for education for all children with disabilities, and assess and assured the effectiveness of the efforts to educate all children with disabilities. This was monumental at the time and really went along with the deinstitutionalization movement in moving these kids into the community setting and therefore the community schools. There was an amendment in 1986 which then expanded this law to include infants and toddlers. In 1990, it was further amended, and the name changed to the Individuals with Disabilities Education Act became the new name, or IDEA, which it's still known as today. There were amendments in 1997 that provided for students with disabilities to participate in state and district-wide assessments by aligning it with the Elementary and Secondary Education Acts for the first time. Further amendments in 2004 adjusted the name of the law to the Individuals with Disabilities Education Improvement Act, and it further aligned the act with the Elementary and Secondary Education Act, also known as No Child Left Behind. It changed some of the requirements that were in the law that we'll talk about in a minute, but just from a historic understanding, it excused from the required IEP team membership of anyone that was deemed unnecessary, if agreed to by both the school personnel and the child's parents. So for instance, if you didn't need a particular specialty on that child's IEP, they didn't actually have to be at the table, whereas before this law, they still had to be in the room. It dropped requirements to have short-term objectives in an IEP, And it allowed IEPs to be changed without reconvening the entire team between annual meetings, as long as the IEP team and the parents agreed. So you didn't have to reconvene the whole team, maybe to make a minor change in the middle of the year that everyone thought would be beneficial for the child. So what is an IEP? So it's an individualized education plan. It is a written document required by federal law for each child who is eligible to receive special education services. It's provided to a student who has been determined to, number one, have a disability, and second, to need those special education services because of that disability. And both of those have to be met in order for you to qualify for an IEP. There are required elements that are listed in IDEA that you must have. Those include present levels of academic achievement and functional performance, measurable annual goals for that child. It must list the special education services, related services, and supplementary aids and services, such as a one-on-one aid or speech therapy or other things that you may need. The amount of time the student will not participate in general education classes. That's why a lot of IEPs actually have the time, a half an hour, that they'll be with the OT, because they're not going to be in general education for that time. How the child is participating in state and district-wide academic assessments. So these are those big standardized tests that all the kids in school take multiple times a year at this point. It needs to include the accommodations to be provided or reasons for using an alternate assessment if the child is not going to participate in those annual assessments. It has to have an initiation date, and it has to say what the projected duration of the IEP is going to be. It must include transition services, so how to transition to the next school or transition to young adulthood. And how students progress towards those annual goals must be measured. So it has to say how they're going to be measured and when periodic reports are going to be provided by parents. So all these things are required to be part of the IEP by the federal law. So this is one of the things that gets questioned most often is, how do I request an IEP? By federal law, a parent or teacher can request an IEP. It must be done in writing, and it must specifically state that it is a referral for special education services. The school district must send the parents a written notice of its decision after it considers the student's qualifications for an IEP. There are no timeline under the federal guidelines. Understand what your state or district may have, and many, many states do have guidelines that must be followed for as long as what the time is for the school to respond to a request for IEP. But those are not under the federal guidelines. And parents must consent to all testing that's being done under the IEP process. So, for instance, if a teacher requests an IEP for a child who's really struggling in school, the school cannot go through the IEP process and do that testing without the parent's consent. So the parent must be on board with the IEP process. And that's, I think, sometimes where we get into some difficulties in working with kids who are really struggling in school, especially for those professionals who are working in the school and really advocating for the child. We have to have the parents on board for this. There are IEPs for preschool children. So many children with more severe ASD or IDD have been receiving early intervention services like birth to 3 services in their state. And once those birth to 3 services, which around 3 is when a lot of them run out, they can be then referred to early intervention services through the school system. And those early education services are provided through an IEP, okay? This process differs slightly in each state, so you may take some time at the end of this to go through what your state requirements are and how to do this. If you are unsure, or you're moving around to a different state, getting in contact with either the state education agencies or some of your local disability agencies can help to clarify what exactly the process is in your area. To qualify for an IEP, you must have one of these 13 disabilities. Those are the only ones that you can have for an IEP. So autism is first. We have deaf-blindness, deafness, emotional disturbance, which a lot of people will, that you work with may have. Hearing impairment, intellectual disability gets us there. Multiple disabilities, so we get some broad categories. Orthopedic impairment, other health impairments, or a lot of places you'll hear OHI. So for our kids without ASD or ID who maybe have ADHD and need some help organizing things, a lot of times those will fall into an OHI or an other health impairment. Specific learning disabilities, so those are your reading disorders, math disorders, writing disorders, speech disorders kind of things. We got speech and language impairment, which I was headed towards. Traumatic brain injury is its own separate category, and then visual impairments. If you don't have one of these, you don't qualify for an IEP. That's the federal law. So that's why there are some broad ones on here that help to cover a broad range of kids. The other requirement that has to be met is that a child requires special education services or accommodation in order to make progress in school. In other words, even if you have a disability, right, there was number one, you had to have one of those disabilities. Number two, you have to require special services in order to make progress in school. So many times I hear from schools, well, but their grades are fine, so they don't need special education services to make progress in school. And that is true. That is the second criteria that must be met to qualify for an IEP. I want to go into a little bit about private school because this is also very confusing. And I want to actually, this is actually the language from the federal law to go over that. So it differs based on if a child is parentally placed, or not parentally placed. So let me give you an example. So if a kid with severe intellectual disability cannot function in this normal school, this regular school environment because of their severe needs, and is moved maybe to a local private school that is run for children with this severe level of need. And the school and the parent working together determine that that would be the best place for this child to go. The school is placing that child in a private school. So that is not a parentally placed child. That is a school-placed child. And their IEP follows them to that private school. Okay, so the IEP is followed in that school. The IEP meetings get really big because they have to involve both schools and the district and all these kinds of things, but that's a school-placed child into a private school, and we all see that fairly often. If it's a parentally placed child in a private school, this is going to be maybe a religiously based school or other just private school that the parents are paying for, the school does not have to provide any of the IEP services or an IEP. So the private schools are under no obligation to provide those services for a parentally placed child. Okay? That doesn't mean that some of these private schools where parents choose don't do a wonderful job. They do. But just understand that they don't have to under the law. And so sometimes you get into a conversation with families about, whether the school that they're placed in is the best place for this child, which it may be, and maybe they get more services there than they do in the local public school system, or whether they need all those specialized services that they would qualify for if they were in a public school in that area. So just clearly understand that to help parents make better decisions on their choices with this, okay? So you have written and requested an IEP, the school has it in their hands, and now what are the school's possible responses, okay? So these are the 3 responses that the school can take under the federal law. They must be in writing, so the school cannot tell mom, oh, hey, yeah, no, we're not going to do an IEP. That doesn't work. It actually has to be in writing, okay? So it can be continued targeted intervention through a response to intervention program, meaning we're not going to go to a full IEP right now, but we have added a mathematics tutor on for 30 minutes in the afternoon with our mathematics resource specialist, and we're going to try that for a little bit to see what happens. If that is the case, it must say how long we're going to give this a try and how it will be evaluated. So let's say the school tells dad, we're going to add a math tutor on for 30 minutes during that resource time, and then in 6 months, we're going to take a look at their test scores and grades. We're going to go back through and reevaluate at that time to see if they respond to an additional intervention. But we don't feel like we need a full IEP at this time. So that is an appropriate response that the school can take. They can deny the request, okay? If they deny the request, the written document that they give the family must include information that was used to make that decision, the factors that were influencing that decision, a description of the options they considered and why they were rejected, and the sources that can be contacted to understand your rights. Okay, so they have to give the families those. And so that written response that's denying it must contain those 4 elements, okay, under the federal law. Or, third, they can agree to evaluate the child for an IEP. It doesn't guarantee an IEP. It says that they're in the process of evaluating for it and that process has started, okay? Remember, even when they say this, the parent must consent for all testing and data collection in supporting this accommodation and this assessment, okay? So the parent still has to consent for all of this. They go through their process and they determine that an IEP is needed, okay? The IEP team actually has federal guidelines as well. They must, once the child is determined to need an IEP, now the IEP team has 30 days in which to meet from the date that it was determined that the child required special education services, okay? The IEP team must meet and review the IEP once a year, and every 3 years they must be reevaluated to see if this child still requires special education services. So sometimes I hear from families, oh, they're looking and they're saying they have to reevaluate everything because they don't know if he still qualifies for all these services. And sometimes I explain, every 3 years they actually are required to do this. Is this a required piece that they're working on? Or are they really truly questioning whether he really needs IEP services? And sometimes that helps them to understand that they actually have to do that, okay? And it's not the school's choice whether they reevaluate or not. They have to. 504 plan. What's a 504 plan? We hear it all the time. It is provided in Section 504 of the Rehabilitation Act of 1973, hence the 504 plan. It requires that a school district provide a free, appropriate public education to qualified students in their jurisdictions who have a physical or mental impairment that substantially limits one or more of their major life activities. It is basically a blueprint or plan on how a child will have access to learning at school, okay? Like an IEP, a parent or teacher can request a 504 plan, and parents must consent for the testing and data collection that will be needed to support them having a 504 plan. Want to be clear, I got some comments from colleagues when these were peer reviewed that a doctor can request an IEP or 504 plan. We certainly can write documentation to support it, absolutely. But by federal law, we can't request the IEP. The parent or the teacher must request the IEP. So while we can play a huge role in this, we actually can't be the ones requesting the IEP. To have a 504 plan, a child must have a physical or mental impairment that substantially limits one or more major life activities, have a record of such impairment, which is where we may come in as physicians, is providing the record to say, yes, they absolutely have this diagnosis, and be regarded as having such an impairment, meaning most people know they have that impairment or that the school is aware. Impairment is defined as physical or mental impairment as any physiological disorder or condition, cosmetic disfigurement, or anatomical loss affecting one or more of the following body systems. And as you see, we pretty much cover everything in this list, okay? And at the bottom, we get any mental or psychological disorder, such as mental retardation. Remember, this was written in 1973. That was the correct medical term. Organic brain syndrome, emotional or mental illness, and specific learning disorder. So they're really good about putting all of our stuff in there at the end, okay? As far as having one of these, which is where you may be asked for a letter to say, yes, this child has ADHD, or yes, this child has a mild intellectual disability. Unlike IEPs, school districts must establish the standards for initial evaluations and periodic reevaluations of students with 504s. This is not a federally mandated timeline. So as you move around, even maybe within your state, this may change. For some states I've worked in, 504 plans are kind of set by the state and the districts follow the state rules. I'm currently in a state where each district has their own policies. So literally in each county, you can't even count on how exactly the 504 plans work. So learn from your families and your parents and your friends at school what this does. Tests administered must ensure that the results accurately reflect a student's achievement, meaning that the testing materials used to look at the 504 plan are tailored to evaluate specific areas of educational need. So if you are looking at a reading disorder, that you're not given a math test. And the test must be validated for that person and given by trained personnel. So this can't be the one-on-one aide giving them some kind of evaluation for their specific speech disorder, okay? It requires that the school district draw from a variety of sources of information. The information obtained from all the sources must be documented, and they must consider all significant factors related to a student's learning. Note that these federal terms are rather vague. And so you may see great differences place to place on what you see in these. A committee making the decisions must be made up of people who are familiar with the student, understand the meaning of the evaluation data, and the placement options or the options for 504 accommodations. There are no standard plans, and the federal law does not require 504 plan be a written document. If there's a document, it generally includes what the specific accommodations and supports are, who will provide them, and who's responsible for ensuring that the plan is implemented. Most places have some kind of written 504 plan, but because there's not a federal guideline, they will differ widely as you read them, okay? One of the things I truly recommend is as you go through training, psychiatry residency or CAP fellowship, every one of your patients who has an IEP or 504, ask the family for it and read it. That will be your best education in learning how to read these, is just reading as many as you can get your hands on. And it has to be periodically reevaluated. There is no timeline that's given. So just to kind of review a little bit the differences between the two. The IEP has many more standardized and regimented pieces than a 504 plan. Sometimes schools will try a 504 first, and if it doesn't work, move to an IEP, and that's acceptable. I mean, they're trying to put in places. Remember, for a school, A 504 plan is a lot less work and requires a lot less personnel than an IEP. So a school that's overwhelmed may be trying this to do their best for the kid, with the idea that if this doesn't work, they'll move to an IEP. One of the most common questions I get in my office is, what do I do if I don't agree with their findings? I don't agree with what they have. And one of the things that you should know is that depending on what your child has, the process that is allowed for disagreement is different. So just take a look at this slide and understand that while both start at mediation, because an IEP is much more federally regulated, there are different steps in a 504 in the actual process. One of the best things you can do in your area as you get started is to learn the different offices around you and different educational advocacy organizations to refer the parents to for help. These agencies are sometimes federally funded, state funded, sometimes they're private, sometimes they're part of the particular disabilities society or group in your area, but they can be very helpful. Disability rights is in all states. It's a federally funded, they're state offices. Educational advocacy organizations are fantastic. There's always legal aid that provides income-based legal services for those families who need that level. Look at your local Autism Society, your local ARC office. A lot of times they have places where they're very familiar with sending families who are really struggling with the school systems. I want to take a closer look at the IEP team that is required. So according to the federal guidelines, the team must include the child's parents or guardians, a special education teacher, a general education teacher, a school or local education agency administrator, so often the principal or assistant principal is this person, person to interpret the evaluation results, so a school psychologist may be present to give the results, and if appropriate, the child. And this especially comes into play when maybe your child has a mild intellectual disability and you're having that meeting about transition planning. Are they going to stay in school from 18 to 21? Are they going to move towards a vocational plan? And really getting the child's opinion on all of that would be really helpful. Severely intellectually disabled nonverbal child who's not going to tolerate kind of sitting in a room while adults talk over all of these details. So it depends on the kid, but think about that. It may be a very important part to have the child there. So we talk a lot about interdisciplinary teams. And luckily as child psychiatrists, and one of the things I love is that we have so many interdisciplinary teams. But I find that child fellows sometimes don't completely understand everybody who's in the room and what the education background of that person is and what they bring to the team. So we're going to go through who can be members of the team. Not all your teams will have these members. These are not all IEP members. They can be other things. And just kind of what their requirements are and what they bring to the table. It's really great because many children have many different needs. And when we get people with different perspectives together, they can really gain a better overall view of that child and what they need. So we're going to go through all these different interdisciplinary team members and start with an advocate or an educational advocate. We hear that term a lot in child psychiatry, and it actually is a descriptive term of what they do, but it really doesn't reflect their background or their expertise. So nationally, there are no education requirements, there are no licensure requirements for someone who calls themselves an educational advocate, okay? Many of them have degrees in education, social work, other things, but know that that's not required. If the advocates work for some states or local agencies, they may have minimal requirements for their hiring purposes. And they really have usually extensive expertise in special education. They're very knowledgeable about the state and federal laws around education and disability rights. They work within the bounds of those laws. Help to educate parents about their rights. I find this is one of the things that I really like is a lot of times the state agency near us will at least sit down or talk with parents on the phone about what your right is or how to formulate their question better, how to use the right verbiage to get the school to do what they want them to do. They can help negotiate disputes between families in the school. Sometimes an advocate can come to an IEP meeting and kind of cool everybody's jets and try to make sure everyone's talking in the same language. But they're not usually involved in the legal disputes. Once it goes up, we're kind of above an education advocate. Again, if you're looking for education advocates in your area, I would reach out to the local either Autism Society or ARC or one of the other agencies and ask who they recommend for those things. Sometimes it's just a fellow parent who's been through this process a lot and helped a lot of other people through this process. That can be very supportive to families. So our behavioral professionals, many different titles that they can have depending on what's going on. So a behavioral psychologist has a PhD or a PsyD in behavioral psychology with both pre- and postdoctoral clinical work in that field, and is licensed according to the clinical psychology laws in that state. A behavior analyst is someone that has completed a certificate program as a board-certified behavioral analyst, and so they have BCBA after your name. It can be someone who's master's prepared, doctoral prepared, it doesn't, but they have BCBA. And their licenses for some BCBAs are available in some states, but not all. And then behavior therapist is a term that's kind of thrown around. It can be many different things. It can be someone who's master prepared. It could be someone who's a line therapist and is being called a behavior therapist. It's differently, and there are no really requirements. So sometimes it helps to learn what their background is. Behavioral professionals often are the ones delivering ABA or other behavioral modalities to kids with ASD and IDD. Many times they observe in the schools and homes for several days. They help to change unhealthy, destructive behaviors into positive and uplifting ones, changes and improve actions and emotions. They are using largely behavioral modeling, classical conditioning, operant conditioning, and cognitive restructuring to work with kids in their behaviors. And they help train parents and staff and the others who care for those child to implement those behavior changes. Neuropsychologists have a doctoral degree in clinical psychology. They have 2 years, usually a postdoctorate in neuropsychology in their postdoctorate years. They're licensed as clinical psychologists by each state. And most states require the passage of the examination for professional practice of psychology, but some states don't. There is a board certification for neuropsychologists, but it is not required for practice. A neuropsychologist helps to relate brain structures and systems to thought and behavior through the use of history gathering, examining records, clinical interview, and formal standardized testing. They help to determine how improvements can impact overall functioning, and they deliver those tests. So they're giving ADOSs, IQ tests, educational tests, all the different things to help us really figure out this kid's strengths and weaknesses, and help use those tests to understand our increase of their cognitive and behavioral. Occupational therapy. An occupational therapist has either a master's degree or a doctoral degree. There are licenses in all 50 states. They are required to take a national board exam to be licensed. They really help people across the lifespan participate in things they want to do or need to do through therapeutic activities. They help children with disabilities participate more fully in school and social situations. They help people recover from injuries or regain skill. And they can provide support for patients who are experiencing physical or cognitive changes. Some occupational therapists have additional training in sensory integration and really can help determine children's needs for the specialized evaluation and interventions for sensory integration. They can look for and identify modifications in the environment that help limit the barriers for performance in everyday activities. This includes things like discovering that maybe some kind of decibel reducing earplugs or headphones may help a child continue to participate in a general education classroom. It was just too loud. Or sunglasses sometimes in just regular rooms can help decrease some sensory overload. So it can be things that simple. They can also teach and model activities to support sensory or motor or behavioral needs and come up with other strategies. Weighted vests, weighted lap blankets, all kinds of different things that might help our kids be able to more fully function in other environments. And they can really help sometimes raise the individual's awareness and the impact of their sensory modem and help give those kids and adults the ability to overcome those. We all have some sensory things. We don't like tags, or we don't like wool, or we don't like certain things. And sometimes just becoming aware of that and making choices around that can really help. And they might be able to help somebody with mild ID understand what bothers them and how to deal with it when those things happen. A physical therapist was previously master's prepared. So those that you've been working with for a long time may be master's prepared. However, entry to these programs in the U.S. no longer exists. You actually need to enter a doctoral physical therapy program, which is a 3-year post-bachelor program that is accredited by their body. They're licensed in all 50 states, and there is a national board exam that they need to pass. A physical therapist diagnoses and manages movement dysfunction and enhances physical function and abilities. They restore, maintain, and promote optimal physical functioning and optimal wellness and fitness as it relates to the quality of life. And it prevents the onset or further progression of other impairments or functional limitations that may result from disease or injury. So as opposed to OT that usually works more with fine motor skills, physical therapy a lot of times works with gross motor skills. So they may help our kids who fatigue easily walking, or maybe who fall frequently, and so they can help strengthen core, hip, and leg muscles to help them not fall as frequently. Clearly, we as physicians interact a lot with individuals who have ASD and IDD over many medical issues. And many of you have worked collaboratively with these specialties and many other specialties who are not on here, because we have to figure out what's going on as well. And sometimes it takes specialties that you don't think of along the way to come up with things. For example, I have a patient who, after following him for 3 years, I realized that his behaviors were horrible every spring when the pollen came out. But he didn't have a runny nose and watery eyes. I suspect he had headaches and fatigue, which are, the number one symptoms of allergies. And believe it or not, Claritin worked, not Risperdal, to correct his behavior. So sometimes you need all kinds of other people that you don't think of, asthma and allergy. One of the people I don't have the list that I rely a lot on is gynecology to help with my adolescent girls as well. So lots of different physicians that are important and I didn't want to leave out in the team, and can be maybe members of a multidisciplinary team depending on the needs of your patient. School psychologists training, so they can have a master's or a doctorate in school psychology. There is a national certification board, and they must be credentialed in the state that they work. So there is licensure credentialing for each state. A school psychologist role can be very different depending on where you live, but basically they are there to help improve academic achievement and promote positive mental and behavioral health in the school, to help learners. They may be working with the school to make sure the school is a safe, creative, positive environment, strengthen family and school partnerships, improve the school-wide assessment process, but also monitor individual students' process, and maybe do the educational testing depending on what their background is and how your district works. Service coordinators, case managers, there are many, many different titles depending on what state you work in or what district that you work in. They can have many degrees in social work, degrees in psychology, counseling, education, different things. They can work for many different agencies, in the county or the state, the hospital, the service agency, many different places. They basically help the family obtain services by advocating for their needs and connecting to those services, and help navigate our very complex systems of care. We often need their assistance to help advocate for higher levels of care or more intense services or increased number of services for families. You can take some time at the end of this and talk about your state or county and where you find those people for that group. Many times you can contact the state or developmental disability locations to find out where those are in your area. Social workers. Social workers have a bachelor or master's in social work from a program accredited by their body. In some states, actually, a bachelor's prepared social worker can be licensed as a social worker, but most states require a master's degree. Most of them require postgraduate supervised clinical time for licensure. Okay, but each state, the amount and supervision and length differ quite wildly. And they do need to pass a board exam. The Social Work Board actually has 4 different board exams because of the very large and different roles social workers can have. So their jobs differ quite widely depending on the settings and they work. They can work in hospitals, where largely we're used to interfacing them on the inpatient units kind of as part of the floor team that helps figure out discharge planning. They can work in schools to help the school liaison with the community and with families. They can work in case management for agencies such as in foster care or different things like that. In child welfare agencies like foster care, and in clinical settings. They can actually be psychotherapists as well, and there's a clinical exam for them as psychotherapists. So when someone introduces themselves on the team as a social worker, you're going to need to define what their role and background is, because that doesn't really tell you what their expertise in and what their role is. So that's one to just be careful that you make sure you understand what their expertise is. I know in my clinic we had several social workers who are psychotherapists and wouldn't know the first thing about case management because they've never done that. They've been clinical therapists their entire life. So make sure you know who's there and what you're talking about. Special education teachers require a bachelor's degree with a major in special education or a master's in special education and are licensed by each state in their teaching license. Some states it depends on the licensure if it's a public or private school. Sometimes private schools are not required to have their teachers licensed. It depends. And some states actually require a master's in special education to be licensed as a special education teacher. Special education teachers work with a wide range of students who need special education services. So they can have learning disabilities, mental, emotional, or physical disabilities. And it is their job to adapt the general lessons and teach all the various subjects. So unlike the rest of the teachers who, I teach math or I teach reading, they need to do all of it and at whatever level each kid needs in their classroom. So these guys have a tall task ahead of them to try to change all that material to what each kid needs. They help develop the IEP plans for each student, and they're in charge kind of at implementing parts of those plans, assessing the student's performance and tracking their progress. They have to supervise all the extra teaching assistants that are in their classroom to help various and sundry kids. And they have to prepare and help transition each student for each grade and graduation. So they have a tall order and a lot of extra paperwork and a lot of extra stuff. So I really try to keep this in mind when talking to the special education teacher. They've got a classroom full of kids, all with different needs, and they're trying to manage all of those at the same time. Speech language pathologists have a master's degree or a doctorate from an accredited program. And some have masters in related disorders, such as a master's in specifically communication disorders or things like that. There is a national board exam, and they must complete a clinical fellowship for eligibility. They are licensed and certified by each state. They work to prevent, assess, diagnose, and treat speech and language, apraxia, social communication, cognitive communication, swallowing disorders, and feeding disorders. So they do it all. Speech disorders, when it's both production of speech, so the sounds correct and fluently, as well as problems with the voice and resonance. And language disorder, so when people have trouble understanding receptive language and or sharing their thoughts in expressive language. They're a great source of a lot of information about communication disorders. One of the things to remember is that if a child doesn't speak, it doesn't mean they don't need a speech-language pathologist. Actually, they probably need it more to help us figure out how to communicate with this child and have them help us implement communication tools to allow this child to continue to communicate with us, even if it's not verbally. So they're very, very important parts of the team. In summary, it takes a lot of professionals, parents, advocates, educators to help with children who have intellectual disabilities and autism spectrum disorders to reach their full potential. And having each member of the team bring their particular expertise to the table allows for more possibilities for help, more ideas, and more just novel things to do to help a child. So know the laws in your area so that you can help be an advocate for parents, so that you can help parents navigate this really tough system, and so that everyone on the team knows that this child will benefit from working together. So in summary, the care of individuals with neurodevelopmental disabilities requires a multidisciplinary, coordinated approach. And educational services and advocacy are an integral part of the overall treatment plan. And involving parents in the process is essential. Parents are always their child's best advocate, and having them a member of the team is really helpful and beneficial. Thank you so much.
Dr. Koth, what a great talk on the multidisciplinary team and the IEP process. Thank you.
Thank you.
Had a few questions that we wanted to present to you. The first is, let's say we have a family and the parents have requested an IEP and they never heard back from the school. What comes next?
Well, the first thing I do is talk to the family about how they requested the IEP. A lot of times they think walking in the front office and just saying, I want an IEP as a request. It has to be in writing. Okay. And it has to have the things we talked about. It has to have the date on it. It has to say it's a request for special education services. So one of the things I do is ask that and educate families on how to request an IEP. For families who need more help, sometimes I've written it during the session in the office with them if they don't have access to a computer or printer at home. There's also wonderful websites out there that have templates on them on how to write an IEP letter. There are many agencies that have those available if you just put it into your search engine.
That's interesting, because that can help a lot of people.
It can help a lot of people get them on. And then I usually say keep a copy of, have a copy of the letter, keep a copy of the letter, see if the person you give it to will write on the top what date it was received by the school. Yep. Then you actually have something to go to someone else with and say they didn't respond in the time. Make sure you know your state's response times. Right. Sometimes families have come and said, well, I turned it in last week. Well, the school's not going to get back to you quite that quickly. Okay. So help educate the families and figure out how to advocate for them, but make sure they've actually requested it properly.
Absolutely. So it is a formal process to be done in writing.
Right.
Yeah, and I like that piece that you mentioned in your talk and just now about the physician getting involved in that process. While they can't formally make the request themselves, they can be a huge part of the process.
Absolutely. And you're certainly able to write a letter to support it, call the school and help out. There's a lot of things you can do, but that initial request really needs to come from the parent.
Yeah. Yeah. Dr. Koth, there are a number of families who make the request for an IEP. And I know you mentioned in your talk that sometimes kids have excellent grades and they're not causing disruption and they might not appear to need an IEP, but they really do need one. So what happens if the school says no and you and the parents still feel that the kid really does need an IEP?
So this is where it's really important to have knowledge of the educational advocates in your area. The state agencies that may provide advocacy for parents, maybe private agencies where people can hire an advocate if they wish, or even your local disability rights agency to really help advocate with the school and help educate the parents about maybe how to request things differently or how to go about differently. Sometimes educating the families too on exactly why and how, the exact things they must meet. Because sometimes it's easier to ask for a 504, or sometimes it's easier, do you know what I mean?
To start small.
To start small,
yeah.
And try and get that help that's available. Because unfortunately, you have to meet those two criteria. And so it's really, and it happens all the time, and I wish the kids got more support. But if they're doing okay in school, then they don't qualify. But a lot of schools are more than happy to do a 504 to help, like I said, with maybe organization with ADHD, a homework reminder guide for an older kid who's still struggling with that, does the homework but doesn't turn it in the morning.
Exactly. Oh boy.
Yeah, exactly. And so sometimes there are other things that are possible besides an IEP, and you just have to help navigate with that. But your education advocates in your area can really help.
Absolutely. So bringing in that outside advocate can be a difference maker because it can kind of unlock the process and facilitate for the families.
Yeah.
Yeah, great. Okay, so had one more question. So I have a team of specialists to work with in my practice. Does that mean that I shouldn't see patients with autism or intellectual disabilities?
That's true. So I don't actually have a team in my practice at all.
Okay.
I actually am seeing an entire practice of these kids in a general psychiatry practice. I don't have a multidisciplinary team. I don't have an institution that has something. So my answer is always no, because you actually can do a lot.
Yes.
The medication management portion of this is important to be done correctly, right? It's really important. But if you do this alone, you really do have to know where to hand these things off, because you can't be an education advocate and a disability rights person and your own social worker. But knowing what your agencies are in your area. So how strong is your local chapter of your Autism Society or the ARC or any other, the many of the genetic disorders, Tourette's. They have wonderful support groups in their area. A lot of those families have been through these issues and can really help support the families in a way that we just can't.
Yeah.
And so relying on all of those and knowing where to turn really helps, because ultimately listening to the family, being a part of their journey is just helpful in and of itself.
Absolutely.
And being that person who can do the medical evaluation, kind of listen, hear with a different ear, and understand that this is probably constipation and not a new behavior issue is incredibly valuable. And you as the medical professional are the one person on the team who's listening with that different ear.
That's right. Yeah, and I really encourage all the psychiatrists out there to roll up their sleeves and get knowledgeable about the IEP process, because you can have a huge impact. Maybe even more than medications.
Yeah, and yet you don't have to do. It's not like you have to go to the IEP meeting or you have to do all that time. Sometimes a letter can be incredibly valuable.
Absolutely.
Or sometimes just explaining things. I did participate in an IEP meeting not too long ago by telephone, because I felt very strongly the family was ignoring the school was ignoring the neuropsych testing.
Yeah.
But they weren't ignoring it. No one on the team quite understood what it said.
Right.
But breaking that down into a very simple explanation completely changed how they were dealing with the kid.
Absolutely.
So sometimes very small things that you don't feel like is a big thing can be a huge deal.
Absolutely. I had a couple of bonus questions while I have you up here.
Absolutely.
We're so fortunate to have Dr. Koth here, an expert. If a patient of ours has an IEP and they're getting ready to go to college, which would be awesome, what are the rules? Like, does the IEP follow them to college?
It doesn't. So colleges are not public schools, so they don't have to honor anything. However, in this day and age, a lot of schools are providing tutoring services, special housing services, different things for kids who are on the spectrum or who have intellectual disabilities.
Yeah.
Family's going to want to really look into those and help hear about what those are. So an IEP doesn't. However, if a child is continuing in high school or continuing in a transitional program through the public system, those go to 21.
Okay.
And so the IEP does continue to follow them if they're in those programs. So depending on how that's set up, there are sometimes in the community college setting, they are there through the IEP, through the transitional program. So that might be a little different than maybe a traditional 4-year or just going off to community college on their own.
Yeah. That's really good to know, because I know we like to follow our patients through childhood into adulthood.
Yes. Well, and most of us follow them well into adulthood.
Absolutely, absolutely. And then one more question about IEPs, and this is coming from my personal practice. I have a number of patients who are, maybe the parents are bilingual, or maybe they're Spanish speaking, for instance. And what rights do they have to interpreter services in the IEP process?
Absolutely, they have a right to an interpreter in the IEP process.
Okay.
Who is not a family member, just like in the medical field. You know, we are taught not to rely on a family member for translation services, and the school is to provide a translation service as well for the IEP meeting.
Excellent. Well, thank you very much, Dr. Koth. Great talk.
Thank you.